Good morning, I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, I want to continue this morning on the medical tidbit. What I want to talk about this morning is the last electrolyte, quote unquote, in the series this week. All right, and I'm doing Friday because obviously I was off on Monday, so we'll be doing this 4 times a week. I want to talk about bicarbonate, right? Bicarbonate, and it's an overlooked electrolyte. No one even talks about it, right? No one even talks about it, and sodium, potassium, calcium, magnesium, but bicarbonate is just as essential. And what it is one of the main buffering system in our body to keep our blood pH, the acidity, in a safe range, right? So if you have too little bicarbonate, your body becomes more acidic, right? And it leads to something called metabolic acidosis, right? But what folks don't realize is metabolic acidosis in the black population increases your risk of high blood pressure, diabetes, and chronic kidney disease, right? So remember, I stated this before and I'll state it again. Black people are four times more likely to develop end-stage kidney disease, right? And as your kidney gets worse, your bicarbonate level continues to drop because your failing kidneys cannot excrete the acid effectively, right? So the acid sticks around more, binding your carbonate, causing that metabolic acidosis. So it worsens your kidney failure, right? So that's important. And the more acidic that you are, the acidity drains your calcium and your phosphate that I talked about before from your bones, trying to neutralize the excess acid. Right? So we have worsening, not just kidney disease, but osteoporosis, and all these things are affected by a low bicarbonate. Right? We can go into more things, muscle wasting, fatigue, and all these things, but in the interest of time, we'll just keep it to what needs to be known. Right? So your blood alcohol, your blood bicarbonate level normal is between 22 and 29. So when you get your lab work and you're looking at it and you see bicarbonate, HCO3, then you know what that number means. In chronic kidney disease, your levels less than 22, right, is indicates that you're more acidosis. Let's put it that way, right? And that's not good, right? So how do you correct these things? Diet. Alkali-rich foods. We talk about alkali water and things like that, and some of it can be controversial, but in this context, right, bicarbonate is an alkali. It's a base, right? So it neutralizes acid. Remember that alkali neutralizes acid. So alkali forming fruits helps your body neutralize that acid by supporting healthy bicarbonate levels. Right? Bananas, oranges, cantaloupes, watermelon, papaya, mangoes, grapes, spinach, kale, collard greens, cucumbers, zucchini, broccoli, all these things, right? All healthy things, unprocessed, right? I talked about chickpeas, black beans, almonds, walnuts, and here's the kicker, guys. Dashin, breadfruit, cassava, yam, right? Are also alkali foods. And don't forget your herbs, your parsley, your cilantro, right? Or your shadow benny, the culantro, basil, right? Remember that. And I mentioned that they're rich in magnesium too, right? But the problem is we've given up fresh produce for processed foods. So you see the vicious cycle? So more high blood pressure, more diabetes, more chronic kidney disease. because of these processed foods. And when we were eating non-processed foods and right from the land, we were healthier. Okay? So there are several forms of bicarbonate out there. And I'll tell you, Tums is carbonate, calcium carbonate. Carbonate is also a very strong base. Okay, just to put that out before I forget. Right? So typical doses we want between 400 to 650 milligrams, two to three times a day. All right. Lifestyle changes. I always want to emphasize that. Adequate hydration. Okay. Unless you're fluid overload and your doctor tells you to restrict, you got to stay hydrated. Limit processed foods. Limit the amount of sodas. They're acid producing. Sodas are acid producing drinks. Focus, continue measuring your blood pressure, your sugar, and avoid unnecessary use of medications such as, I talk about Motrin, right? And all these other medications, because they affect the kidneys. And if your kidneys are already failing, then you're adding insult to injury. All right? So I just wanted to put that out there. Bicarbonate is a base. It's an alkali that protects the kidney, that helps buffer the acid in the system. Just remember that. So again, you can add alkali-rich foods to your dietary plan. All right? Enough with the processed food. Right? A cup of spinach, a side of sweet potato. Okay, a banana in the morning. Okay? Slice of breadfruit. These things will keep your bicarbonate level intact and help you be healthier. There's several options out there. Talk to your doctor. Doctors, talk to your patients. I got to keep moving. On behalf of Patient Choice in Chemin, I'm Dr. Dangleben. Peace.